And I am going to go to my slides here really, really quick. Can everybody see my slides so far?
Yes.
So I am going to go into a situation where I can't see you. So, or I can't see you very well. And go ahead and get started. And so I'm going to welcome everybody back. I'm glad you came back. I really appreciate that. Sometimes I have had series where people just don't come back, and that's always really, really sad. So I am Susan Carr, I'm the Executive Director of CSNO, which is Community Services Network of Wyoming. I am the state association. I'm one of the pieces of CSBG. We have our federal office, which is housed in Health and Human Services. And then we have our state office in the Department of Health under Rural and Frontier Health in Wyoming. And then the state association is the agency that works with the network of all the all the network that uses CSBG funding. So we provide the training and technical assistance around that. And we do a lot of really, really cool stuff. I am really looking forward to going over to Campbell County later this month. We're going to be doing the strategic planning session. And so it's kind of apropos today that what we're talking about today are the different types of plans that we do in CSBG. So our learning objectives for this particular project are slightly different than what I told you they were going to be in the handout and also what we said last week. So we're going to talk about the foundational concepts around the, sorry, I can't read my stuff here, sorry. Understand the foundational concepts that are going to help your local agencies and your subrecipients and the entire network really increase their performance measurement. We're going to talk about ROMA and how that applies in our principles or our practices every day. We're going to talk about how the ROMA cycle, organizational standards, and the performance management framework all work together and how they're intertwined. And then we're also going to understand how to meet and exceed the organizational standards by really focusing on the ROMA cycle. So as we go on, we're going to say ROMA. Throughout the series, we are really talking about the board's role in ROMA. And what does ROMA stand for? Again, it is the results-oriented and management accountability. And we use this in meeting our organizational standards. And today, while we're talking about planning, we're always going to be referring back to how we do the work. Sorry, 1 second here. I lost my place on where I'm at. We're always going to be referring back to how the work we're doing every day is helping our agency to become a high-performing agency by meeting all the organization standards. So you're going to hear me talk about those quite a bit. We're also going to be talking about and referring to the different roles of management versus the board. And many times the board and the management role can become a little muddy. So some of the things to remember as a board member, and this is basic to boards, not just to CSBG, but you have one employee, and that is this ED or the CEO or the grant manager. Your job as a board member is to ensure that you're taking very good care and nourishing that person so that they can be the very best leader that they can be. Your job is to look forward, to provide direction, and be strategic. Your job is not to micromanage the team or get involved in the day-to-day mechanics of that agency. If you find yourself wanting to do that, you really need to step aside and ask yourself why. If you want to talk about how much they're spending on paper clips, we've got a problem. And we got to find out where that problem lies. There are going to be times that I am going to tell you tonight, this is not your role. And there are going to be times when I'm going to tell you it's 100% your role. So please always ask for clarification and ask questions, because I am always going to be here to support you and to help you navigate all of this and what it looks like. So what we're going to be talking about last week, we talked about community needs assessments and really creating a local theory of change. And when we talked about needs assessments, we talked about all the elements that need to be in a needs assessment. And those elements were, we talked about defining our community, knowing who is in our community, where are our individuals who are experiencing poverty living, what are some of the resources that are in our community, what are some of the barriers, what are some of the gaps, what does our community do well, what does our community not do so well. We talked about our local theory of change, and that theory of change is how do we view poverty and our role as an agency in addressing the causes and concerns of poverty. We took a look at the national theory of change, we looked at the 3 national goals, the domains and how we apply our services and our strategies. We looked at performance management, we looked at our mission, we looked at a whole lot of different things. The state of Wyoming doesn't have its own theory of change or a formal document, but we do have a lot of ways at how we look at poverty. We recognize that generally when we talk about poverty, there's kind of 2 kinds of poverty we talk about. We talk about situational versus generational poverty. We understand it's a very complex, very complicated situation. We know that poverty is not just about money. We understand that if poverty could be solved with just throwing money at a problem, we probably could have solved poverty a long time ago. But because poverty is so complex, that doesn't just work. So today we're going to talk about planning around poverty and how we're going to look at our agencies and how we're going to address, how we're going to look at poverty and how we're going to implement those services and strategies to address poverty in our community. Next week, we're going to talk about observing and reporting those results and then analyzing and evaluating our programs and getting back to where we were. So here's where we are again. We're right back at the ROMA cycle. Last week, we reviewed that assessment phase and how important it is for us to really understand our community, who lives in it, where it is, what exists in our community. And today, as I mentioned, we're going to talk about the planning phase and how we can really take the information we gathered about our clients, our agency, and our community and use it to plan how we can best deploy our resources to serve those experiencing poverty in our community. So in our organizational standards, in category 6 under planning, it says that we are required to establish the vision for a community action agency. And we understand that that's a super big task, right? Setting the course to reach it through strategic planning. And that's really serious business. But an efficient and high achieving organization needs to know where it's headed. It needs to know how its board and the staff fits into that future and how it's going to measure it in achieving what it has to do. This process is always going to be board led, and it's going to be ongoing. It's going to be a living, breathing strategic plan. It's going to have measurable outcomes. It's going to have goals. It's going to have action steps, rather than a narrative plan that gets written and then gets put on a shelf and then just sits there. I always urge an ambitious vision in a strategic plan that really sets the tone for the staff and the board and the key leadership, and to be used as a management tool for an entire organization. So we all pretty much are familiar with the idea of strategic planning, but in the world of CSBG, there are some very specific types of plans. And let me look. It looks like we have somebody in the chat. Oh, yeah, you are on my board. You are on my board. That's right. So what is planning? What do we need to consider? Planning is nothing more than just thinking before the action takes place. So as this process goes through, the board is going to consider many things. We're going to consider the results of our assessments that identified and prioritized our needs. It's going to consider the resources that are available or maybe possible to us. And they're going to consider what you believe your mission is. And that is really what our local theory of change is. I am going to ask you guys, somebody is not muted. I'm going to go ahead and ask you guys all to mute yourselves really quick because I think we're getting some feedback. Okay, thank you. All right, so I go back to where I was here. All right, so again, we are going to consider a lot of things before we go into our planning session. We're going to use all the information that we talked about last week to identify how we want to move forward, how we're going to identify our goals, and how we plan to achieve them. So next, why do we want to plan? Right? Why do we want to plan? I really truly believe, even for those people who I just like to, fly by the seat of my pants. I really believe most human beings, unless you're a total anarchist, really do like to plan. We are primarily very intentional about the way we make decisions. Most of us like to plan. We make dinner plans, we make road trip plans, we make vacation plans. And you think about all the things that you have to do in your daily lives, in your professional lives, and in your personal lives, because we're constantly having to make choices about what we're going to do, how we are going to accomplish what we have set, how are we going to address and meet our priorities, how do we change and adjust to meet demands and so forth. And I always use this example in Roma. I am not a great planner, okay? I am the single mom at home who always forgets to take something out for dinner, always, always. And when dinner time comes along, we end up at Pizza Hut more often than not because I have an inability to really do a good job in meal planning. It's just my reality. Like it or not, that's just who I am. I'm not good at meal planning. Consequently, I have repercussions of that. There are things that happen because of my failure to plan around meals. It costs more money. We don't eat as healthily as we possibly could. There's a lot of things that happen because I failed to plan. But when it comes to travel, I'm all on it, right? There's nothing worse than going on a vacation and not knowing if I have a hotel to stay in or what route we're going to take or anything. There's other times when maybe planning is not as important. Maybe taking a random road trip and flipping a coin at each intersection to see what direction you want to go in is perfectly appropriate. But in most cases, it is so important for us to be able to know where we're going in our agencies. So last week we talked about how important it was for our agencies to be focused on results. It is no longer good enough for us to say, I provided 400 pounds of food. We have to be focused on the outcomes, the changes that occurred because we provided that food. It's only through the ability to plan that our community action agency or our clients are able to achieve results and are able to achieve those at a level that is so good that that's the basis of accountability for us. And not just us in community action, but for all federally funded programs. I would argue that if you are the recipient of any type of funding, whether it be federal, state, local, or private donations, you have a responsibility to be accountable for your outcomes. You should be able to show your funder what you did and how you did it, and that you were successful in being able to do it. And once an agency understands their mission and has that clear, comprehensive view of the community in which they're going to operate, the next step is to create that plan that identifies the results that an agency is going to work toward. So while creating a strategic plan the right way will allow an organization to manage effectively and efficiently. And at the end of the day, it's also a legislative mandate for us using CSBG plan or CSBG funding. It's not just a box we have to check. It really is an opportunity for us to be accountable for the funders and the taxpayers who have entrusted us with funds to be able to help the most vulnerable among us. So let's talk about the different types of plans that occur in our world. Using CSBG funds, there are 3 plans that we have to work around. There is the Community Action Plan, the agency-wide strategic plan, and proposals for funding beyond CSBG. And each year during application process, each agency is asked to create a community action plan. For agencies who only have CSBG funding, this is your yearly program plan for how you're going to use CSBG funding and how it's going to be used to develop your application, the budget, the services, and the strategies that your agency are going to use to address poverty in your community. This plan is where we are going to find our community, our agency, and our family or individual goals as identified in that community needs assessment. Now, for those agencies that receive other types of funding like TANF or VITA or HUD or other local, state, and federal funding, the Community Action Plan is still used to only plan around CSBG funding and may use shared service and strategies that are paid with from other funding sources. This is called braiding funding to provide the same services that you're providing with CSBG, but will only use a budget using CSBG funds. I do want to note here, though, really quick, that CSBG funding has never been intended to be used alone or as a single funding stream for any agency, public or private. Its intended purpose is to be leveraged against other funding streams to strengthen programs and to create lasting sustainable programs. So Campbell County is an example of a public agency that uses multiple streams of funding to help their subrecipients provide services. So for instance, and Kristen, you might want to pop in here really quick in case I get this wrong. As I understand it, you guys manage several different pots of funding that the CARES board kind of manages, and they will use that to address different causes and concerns of poverty or needs in your community. I think you manage TANF or temporary aid for needy families.
Yeah, and there's a funding for problematic gambling as well, and that we took on. I'm thinking of maybe putting the opioid funding from the opioid settlement under us as well, because I manage that fund as well. But I couldn't, and the county 1% to our human service agencies. And because I couldn't really think of another way, an appropriate way to actually say I'm doing a community action network, other than kind of having this web of funding that when you put it all together, it kind of looks like it creates a web of funding to support those, to lift people out of poverty in our community and provides a variety of services. So that was kind of the thought process behind adding in and the oversight of those funds to our tripartite board, the CARE board, and then that way, it mitigates duplication of efforts, and it gives a connection to, like, if a county 1% agency recipient is working on something, but another agency is either filling that, or there's some way that they can either augment each other's services or partner, then we can make those suggestions and get them connected and help them with their networking so that the funds can be leveraged in a better way.
Absolutely. Now, nationally, CSBG funding leverages an average of $8 per $1 a seat funding in agencies across the United States. Now, last week we talked about CSBG is used a little differently in Wyoming. Nationally, LEAP, or the Low Income Energy Assistance Program, the Weatherization Program, and Head Start all fall under that umbrella of community action. In Wyoming, those are all siloed out into different government agencies. And so they don't fall under our community action agencies, yet we consider ourselves to be pretty close siblings. But there are other funding opportunities like TANF, or Temporary Aid for Needy Families, or HUD around low-income housing, family sustainability funds. There's community development funds. There's a whole lot of different funds that happen around this that can also be leveraged and brought into agencies. Some agencies only have CSBG funding, and that is just the way it is. I mean, that's just some of the way it looks. But most agencies, even in Wyoming, bring in a mixture of private and public funding to allow for different types of sustainability and funding. So that's your community action plan. The community action plan in Wyoming is built into our application. It is 1 year only at a time, and it is a required part of what we do every year. But we also, in our organizational standards, require that our agencies plan for the long term, for 3 to 5 years at a time. And this is more of an agency-wide plan that takes into account several different types of fundings, programs, staffing, additional maybe areas, communities. It's very broad and it's very audacious in nature. And this plan should be pretty comprehensive and agency-wide. It's going to include your long-term goals, but it'll also have your action steps and the means to measure achievement or progress to those goals. And it creates a unified understanding of why we're all here, from the board to the staff to the volunteers to the funders. Now, some agencies have strategic plans that focus on agency development only, and they put their family and community planning in the community action plan, and that's fine. That's absolutely appropriate as well. But it is important for the agency-wide plan to include some references to the community needs assessment, the customer survey outcomes, and what your agency plan is for the coming years to address those identified needs. It's just kind of one of those things that's required in our organizational standards. So if you can make those references back and forth to each other, it's just a better way of meeting those org standards. This is also where you would address your local theory of change or develop your vision, your mission, your values. This plan is developed not only on who we understand ourselves to be, but who we want to be at our best in the future. So that's where that strategic plan is different from your community action plan. Remember, community action plan is where what our plan is for the upcoming year. And our agency plan this is the bigger picture of who we really what we want to achieve in the long term. And then finally, for those agencies that are seeking additional funding streams, we often have to write grant proposals. And in effect, those really are planning documents, right? Those are basic planning documents at their core that talks about, if you give me $5,000 to $25,000, this is what I'm going to do with the money. This is what our plan is, and this is what we hope to achieve. So as we go through that, before we go into anything else and what the role of the board is in creating these plans, does anybody have any questions? Okay, not hearing any, we're going to go ahead and move on. All right. So what role do you as board members take in creating the plan, right? So what is your role? What is your responsibility when it comes to the strategic plan? So I think always first and foremost, it is the responsibility of the board to ensure that the agency has a mission that addresses the reduction of poverty and that the agency has the resources to do so. That is the basic responsibility of a board. I don't care if it's a CSBG board, an arts board, a library board, a government board. You have to know why you're meeting and that you have the resources to do what you say you're going to do. But in CSBG, your mission does need to address the reduction of poverty, and you have to be able to approve the plan. So organizational standard 6.1 says that while the organization or department has an agency-wide strategic plan or comparable planning document in place that has been approved by the governing board within the past 5 years, or in the case of public agencies, that it has been reviewed and accepted by the tripartite board or advisory board within the past 5 years. And then organizational standard 6.2 says the approved strategic plan addresses the reduction of poverty, the revitalization of low-income communities, and or the empowerment of people with low incomes to become more self-sufficient. So remember from last week, these are 3 national goals, right? Goal 1, individuals and families become stable. Goal 2, communities are healthy. And goal 3, people with low incomes are engaged and active in giving back. So that's our refresher about what is driving us. So we know going backwards that we have to have that mission, we have to have goals, we have to appraise our progress, and we have to approve the plan, and we have to make sure that those 3 goals are being addressed. But what role does our management and team have when it comes to the strategic plan? Well, their job is a little bit different because their job is to actually do the work and carry out the plan set out by the board. It sounds pretty simple and clear, but I mean, a very big but. These 2 teams should still work collaboratively to come up with this ambitious plan that seeks to stretch the agency, but is still very realistic and achievable. Collaboratively is when the best agencies come together on a strategic plan and a community action plan. That's when we become the most effective and when we do the best work. So their job is to make sure that once the board has set the overarching goals and achievement, they need to do the work. So they're going to set the actual action steps, and they're going to support the work of the board and adhere to the budget that the board set. They're also going to be in charge of demonstrating effective performance by measuring and reporting back to the board that the work that they're doing is working, is active, what they're is effective. So because we're performance management and we're results oriented, we value accountability. We talk about accountability all the time in ROMA. And why should the strategic plan or the community action plan be any different? We need to reflect constantly on our process, right? So when was the last time you guys as board members remember reviewing your CAP or your strategic plan? When was the last time you remember anyone talking about how you were progressing? How do you know you're progressing? In the organizational standard 6.5, it doesn't ask us for much. It just says, hey, once a year, can you please make sure that the governing board or your advisory body has received an update on progress meeting the goals of the strategic plan within the past 12 months? I'm going to tell you that's not enough. And I would suggest the state's going to ask you for a review of the community action plan on a quarterly basis. For those of you, if you haven't seen it yet, you're going to be seeing it at your next board meeting where they're going to review your community action plan, what progress has been made on that community action plan, and why or why not we've made movement or not. This isn't just a good idea and a requirement from the state. This is about best practices and is really designed to keep the staff and board on top of these responsibilities. I'm going to share with you, honestly, the best piece of management advice I ever ever received. And that is from my dad. If you expect it, you better inspect it. And that's what comes down to the bottom line of what accountability is. We can sit there and put measurement pieces in place. We can set goals. We can do action steps. But if we don't ever really follow up on our progress or ensure that somebody is actually doing what we said we're going to do, then it's just a strategic plan and a document that sits on a shelf and gathers dust. And it is a waste of time and effort of everybody who was involved in that process. So now what? We know what kind of different plans are required for our agencies, but what do we need to know next? We have to make a plan. And that kind of sounds hard, but it doesn't have to be hard. It does, however, have to be intentional. It has to be thoughtful, and it has to use the data that we collected in the assessment phase. We're going to ask ourselves some questions of the information that we collected. We don't create our next year's plan in a vacuum. And right now I'm kind of talking about our community action plan. We use what we did last year as a starting point. We know that we got updates on our progress throughout the year. So we've been asking ourselves these questions. Hey, if we aren't meeting goals, why or why not are we not meeting the goals? Did our best estimates of numbers of clients we thought we were going to be serving from last year come in pretty close, or were they way off? What stood in the way? What barriers do we need to overcome? If we did meet our numbers, is there still work to be done? Can these questions or this work that we did last year, can this lead to something new or maybe something extended and related to what we've already been working on? Let's look carefully at our customer satisfaction surveys. What are they telling us? Do our clients feel supported? Do they see something maybe we don't? Are they experiencing access issues? Are they finding what they need at our agency? How can we improve or strengthen this work that we're doing? Is it going well? Do we need to change how we're doing business? These are great questions that we want to be asking ourselves anyway, but Org Standard 6.4 tells us we have to be using this information in our planning process. So for those of you that have subrecipients, if you're not the agency that is running the direct services, for instance, well, we'll use Campbell County as an example again. The care board itself is not the agency that's running direct services. Instead, they rely on a collection of subrecipients to do different types of work throughout the community to make sure that people experiencing poverty are receiving the services that they need. So they depend on those subrecipients to be surveying their customers. Do you feel supported? Did you have any problem receiving services at this agency? Were you treated fairly? Were you treated with kindness and empathy? Were you, did you feel like what you received there helped move your life forward? Those are things that we have to gather that information, we have to analyze that information, and we have to plan around it. Hey, if it was all perfect, great. What do we need to do to keep going and keep being great? If it wasn't so great, do we need to take a look at what's going on at that subrecipient over there? Do we need to take a look at their hours? Are they only open on Tuesdays between 12 and 12:15 in the afternoon? Are there reasons why clients are not getting the services that they need? I think that those are really important questions, and sometimes it's really easy for us to just skip over that part. But it's really critical for us to understand how we are not only being perceived in our community, but are we being responsible to our clients and our customers, right? So I think that not only are we asked to do it through our organizational standards, But again, I'm going to urge you, look beyond just checking that box and saying, yep, I did it, but really using it in a meaningful way. This is important information. And I'm going to challenge you in thinking, who else might be our customers? Funders could be considered to be customers. Our own staff could be considered to be customers. Finding out what they think could be critical into how we use that information and planning in forward for what we're going to do next year or for the next 3 to 5 years. So we want to look at community needs assessment. So I'm looking at my list. I'm like, where do I leave off? The next bullet one is, do we understand our latest community needs assessment? Is it still accurate? Or maybe our community changed in a radical way? Do we need to reassess something that isn't being addressed in our document? Let's look at our demographic information that we collected in-house last year. How does it stack up against the demographic information in our most recent CNA? Are there gaps in services for specific populations like aging or childcare? Did our agency data show that we served the population in need, or did we serve the population we thought we were going to be serving? Is there a portion of the population that we aren't serving despite the data telling us that there's a high need area? This is the part where most agencies are going to do some type of environmental scan, assessing the current realities of their community and the agency and the community. Most of us are used to seeing these in the form of SWOTs, or strengths, weaknesses, obstacles, and opportunities and threats, or maybe through staff surveys or facilitated conversations around contradictions, barriers, and strengths. But I think these are the things that we all have to consider before we start going into a plan. What do we know? What do we don't know? What should we know? And what have we changed? And the next thing that we need to know, how much money do we have? That's a critical question, right? We know that all of our agencies, hey, our resources are not finite. There is a limit to the amount of money we have available to us. That is just a fact. There are 2 ways to work with money. We either raise more money or we spend less money. And before we can determine what we can invest in our services and resources, we need to really have a solid understanding of how much money we're going to have available to us. Now, in CSBG, we get our allocations from the state, and every year the state goes through this big, it's an allocation process where they take information from every county and look at unemployment rates, SNAP benefit rates, LEAP rates. There's probably about 12 different metrics that they take a look at. They average that all out, turn it into a percentage of poverty. And that percentage of poverty is how it is determined what percentage of the Wyoming allocation that is going to be available to your county. So we know that before the application process starts. So we're lucky to know that our CSBG money, that's available to the board members ahead of time, and we're able to consider the feasibility of how we're going to provide the proposed services and strategies for CSBG funding. We know that up front. That changes very little from year to year, but we really need to have a little bit more information before we go into our budget, because we need to know and understand what it costs to provide services, what those costs are that are connected to outcomes and results. We need to know and understand that the budget has to be realistic in relationship to the strategic plan. We can't say, yeah, we're going to build a new building. It's going to be awesome. And it's going to be about $8.3 million. Yeah, I understand we have a budget of $500,000, but if we wave our magic wand, we'll figure out $8 million worth of funding somewhere. We can't, that's not realistic, right? We have to take into consideration also what it costs to provide effective services. If you do not consider the cost of administration of the agency in your staff, then you're doing a huge disservice to the agency, the community, and to the clients you serve. Remember, CSVG is not about counting the number of services that we provide. If it were that simple, we could just put out a box of gift cards. I say this all the time. We could just put out a box of gift cards, gas cards, food vouchers, phone cards, call it a day. And just let people take that and we can say, yep, we put out 1,000 cards and they're gone. And so we address poverty. We are called to reduce poverty. And we are called to be accountable to those outcomes. That ain't so simple. That takes time and that takes people. That takes resources. It is a very fine balance that we have to walk on a daily basis. And we're going to talk about this in detail a little bit later, but are we creating an entitlement system that keeps people dependent on handouts, or are we creating a system that provides a hand up for those individuals who are willing to work towards non-dependency and moving forward economically? That is an incredibly complex conversation about situational versus generational poverty, but one that has to be considered. And the reason we're having that conversation is going to depend on how much money we have to spend. So how do we know what we're going to be able to provide? We have this much money, we have this much need. How are we going to put those things together? You might remember this slide from last week. We talked about the community needs assessment and the top needs that are identified in our community. And childcare might be at the top need, right? But if your community doesn't have childcare, then it might be beyond the scope of your agency to be able to address community-wide childcare. Unless you have the means to open up a childcare center, I don't know how an agency would be able to address a shortage of childcare. Your mission may not even meet that. Your mission might be around housing. And childcare is not a part of your service area, and it is not what your staff knows how to do. CSVG does not expect an agency to change its mission just to address an identified need. It may mean that you also don't have the experience providing or meeting that particular need. So how does an agency go about deciding how it can meet the needs of the community within its knowledge and its resources? Well, sometimes it's helpful if we understand the different levels of need. So we're going to go in and we're going to talk about some different levels of need. And this can get a little complex. So I'm going to try to explain it as easily as I possibly can, but I'm going to look at you really quick. Do not hesitate to stop me and ask questions if you have any questions, okay? Okay. When we talk about our needs that are identified in our community needs assessments, we have to break them down into different categories. So if I were to ask any agency in Wyoming today, what is the biggest need facing your community today? I would bet the farm that most would say housing. So for the sake of today's series or today's conversation, we're going to use housing as our example, but this is where it gets complicated. What about housing is the need, right? So when we look at the individual or the household level of need, we can break it down easily. Dude, our household can't afford to pay rent. So as an agency, we identify how we're going to meet that need. They can't afford to pay rent. We're going to make their rate payment for them. And our outcome is they avoided eviction. So we're going to meet that need through an emergency service. We're going to provide that service and we're going to send them on their way. Or maybe we have the resources and the skill sets to be able to provide case management in our agencies. We can do the same thing. They still can't afford rent, but we're going to take it down a different path. We're going to start asking why. Why can't you afford rent? Why are you at risk of eviction? What's keeping you from being able to afford your housing? Is it debt management? Is it not having the job skills for available high-paying jobs? Is it not having the ability to drive to the job? Is your poor health keeping you from working? What about your mental health? How about your teeth? How about case management? Looking at the individual holistically and addressing the causes of poverty and working with an individual to remove the barriers that may be keeping them from being able to afford rent on a regular basis. Emergency services is designed to keep someone from moving into a worse situation. It is typically temporary in nature, or is used as a bridge until they can get back on their feet. But sometimes it's the community that's experiencing the need. So let's look at the way that that might look. What if your community doesn't have enough low-income housing to meet the need? Or your community doesn't even have enough affordable or attainable housing or workforce housing to meet the need? What if there aren't any high-paying jobs to provide wages to afford that available housing? What if there is no public transportation to get to available jobs? What if they've got the job and they've got the transportation, but they don't have availability to affordable or even any childcare? Or what if your community doesn't have higher education or trade apprenticeships available? CSBG recognizes that community work, or what we call community initiatives, are categories where agencies can do some of the most powerful work. By using the power of community action and the resources behind it, we can build coalitions, partnerships, and leaders to change what is happening in our communities to become more vibrant and more economically healthy for all who live in them. And these are typical long-term projects. So let me give you a couple examples of what this looks like. So in Sheridan, and I've got Dick is here with me. Transportation has, for the past 20 years, transportation has been at the top of our community needs assessments. And about 10 years ago, Sheridan did a study circles on poverty and determined that one of our greatest needs was poverty. And we could provide all the greatest human resources in the world, but if people could not access our amazing hospitals, our grocery stores, our schools, and work, then having all those great resources in the world didn't matter. So they looked at a way that we could meet a public transportation. And we identified our senior center, then called the Sheridan Senior Center. They took on a project of building a public transportation system. They had in place a small bus that would travel around the community, picking up seniors and taking them to doctor's appointments, grocery stores as needed on an appointment basis. Using CSBG funding, they were able to grow that particular program into a citywide fixed route service. Dick, help me out here just a second. Do you know off the top of your head, Dick, do you know any facts about the Goose Creek transportation? How many, I mean, it's like thousands of people every month use this transportation. There's like 30.
That's right. And what they do, they run buses every half hour on a 34 start route. It's designated stops, 34 of them, through the community. And they started to hub, and they go from one end of town to the other. And otherwise, and that service is free.
Yep.
Now, if people want to go just one place, they can pay $5 and they can get picked up and just go to a particular place.
And
So
they,
there's
yes,
two parts
this,
of the service.
yep, this was a community initiative using CSBG that we couldn't work on that as an individual basis. We couldn't go buy transportation for individual houses. We had to look at that as a community need that helped vulnerable populations get to the places they needed to be able to become more self-sufficient. 20 years of transportation being on our community, being one of the top 3 needs in our community. In our 2022 community needs assessment, transportation has now dropped off as one of the needs because it has become so hugely critical that now the city helps pay for it, the state helps pay for it, CSBG will continue to help pay for it, private funders help pay for it, the federal government grants have come in and helped pay for it. This was a community initiative that was highlighted at the national level because we are one of the smallest communities in the United States to have a fixed route bus stop. These are the kinds of things that can be done with CSBG funding through a community initiative. Are they easy? Nope. They take years, but it really does work. So when we talk about housing, you can see that it's not, we can pay individuals, but if the individual is not the level of need and it's the community, then we have to start talking about housing trusts. We have to start talking about building partnerships to address community-wide child care. We need to talk about bringing in job opportunities, economic development, a homeless shelter. These are things that don't have to do with one family at a time, but as a community as a whole. And those are ways that we absolutely can use CSBG funding. So let's talk about this just a little bit more. Dick, this was a question you brought up last week, and I told you that we would talk about it, was the differences between emergency services and case management. So let's take a deeper look at this, because this, as board members, you guys are going to be the ones that are going to be deciding based on what we know in our community and what we have available to resources, how are we going to be able to meet the needs in our community? And these are the 2 models that you're going to take a look at, right? There are pros and cons to both of these. And one of the things that we have to understand right now, that these are not designed to be either or choices. They are not mutually exclusive. They can be used both depending on the client, the situation, and the availability of the agency's resources. I'm going to give you an example of what this looks like. In Laramie County, they receive over $500,000 of CSBG funding. They have the resources to be able to do case management in a way that really produces change for individuals. Johnson County gets $38,000 a year. $38,000 does not pay for a case manager. They don't have the resources to be able to provide anything but emergency services. Knowing what their needs are versus what their resources are, through their strategic planning, they identified that emergency services is what they will be able to do. Deciding what is best for your agency, your community, this is going to be part of your theory of change. And this is, again, something you're going to consider when you're making your planning decisions. So let's take a look at the pros of emergency services. Emergency services, you can serve a lot of people, right? I can, with $38,000, I can buy a ton of $50 gas cards to help people put fuel in their vehicles to get out to the uranium mines, to get to work until they get their first paychecks. I can pay for people to get food vouchers at $100 to supplement with fresh fruit, dairy, and proteins for what they can't get at the food pantries. I can make sure that when they leave my office, they are getting their immediate need met. That's what I can do with emergency services. Case management, there are some pros to this one too, right? We can bundle a whole bunch of services to address some complex situations. When we've got a person who's like, not only do I have bad teeth that keep me from being able to work full time because I can't take enough sick days for my poor health that is being caused by my teeth that are causing me so many problems, but now that's causing me some mental health issues. In addition to my mental health issues, I also have diabetes, which is causing my foot pain. I can't walk. I really can't see as well anymore, and so I can't drive. And because of those things, I'm also only 35 years old. I don't qualify for some of the disability funding that's out there. If I could get my teeth fixed and I could get my diabetes under control, I might be able to get a good job that would allow me to stay in my house and be able to pay my bills. So being able to bundle services and wrap services around a client is one of those really cool things that case management can do. Case management also allows us to build community engagement to address larger problems, right? So if we've got a problem, a family that's experiencing multiple barriers, we can work with schools, we can work with churches, we can work with mental health professionals, we can work with workforce development, we can work with our local college, we can work with treatment centers. We can build those relationships and build a wraparound team around a family, an individual, a household to make sure that they're getting all the services they need. And it also helps build those partnerships to meet the needs that an agency can't address alone, right? Because as a case manager, I'm not going to be the skill expert on every single thing. I can't know everything there is to know about substance abuse and mental health and job training and budgeting and buying a house. And, there's just, I can't be experts on everything. So it allows me to build my network in the community of resources that I can depend on. But there's also cons around emergency services. Emergency services, for the most part, is never going to address a long-term change. It's just not. Emergency services, as I mentioned earlier, are really designed to be a bridge until, your first, second, or third paycheck comes in. Emergency services are designed to maybe keep somebody from falling further into the hole. They're great for situational poverty, a single parent whose kid broke their arm and that particular ER bill put them behind 1 month. They ran out of food that month and they couldn't make it, but that one emergency service really helped them, tide them over until they were able to get caught up. That's a pro of emergency services. But when it comes to complex situations, like we talked about in case management, emergency services is never going to be the answer. It also puts a lot of resources into services, meaning that you don't have other resources available to build partnerships in your community. It allows for a lot of duplication of services amongst a lot of different service area or service agencies in your community. It doesn't build collaborations, a couple of different things there. But the same is true for the, that's supposed to say cons of case management, my bad. I just didn't even change that. That's lovely. I just did this today. The cons of case management, ignore that. It's expensive. It's expensive to do because people are the resource. People and paying living wages and benefits and payroll taxes can get really expensive. I mentioned the Johnson County example. I can't hire somebody in Johnson County for $38,000 a year. It is not going to happen. But that's what you need, a well-trained professional case manager to make lasting change in a case management model. You also serve fewer people. That's just a fact. You cannot serve 1,000 people in a small case management system. That's a fact. That's a con. Sorry, I didn't have that correct. I'll make sure that that's corrected before it goes out to you. Does anybody have any additions to pros and cons about those two models?
I have a question.
Yeah.
How many counties have case managers?
So we're seeing a shift away from emergency services into a more case management type model because we know studies and research tell us that case management is more effective. We are getting better outcomes around it. I am seeing agencies talk about, I don't have any hard facts for you, Dick, but I can tell you anecdotally, I'm hearing more and more agencies have this conversation. However, I would suggest that agencies recognize a need for both. I think for those agencies that are having conversations about only doing case management, I think it leaves out a very important piece of that situational poverty like we talked about, the single parent who just had that one bump on the road. They're doing fine maintaining their household until that one emergency. I mean, the reality is 63% of all Americans are one paycheck away from being homeless, one emergency away from being in financial crisis. So I think we do a disservice unless we can identify another agency in our community that can do emergency services. In a lot of communities, that's our faith-based organizations. So we look at ministerial associations that have emergency funding for gas cards or food cards. We look at our food pantries as emergency. We look at LEAF. A lot of us relied on emergency rental assistance while that money was around. If you can identify somebody in your community that can do the emergency services and you can refer out to them, I always think that that's great. If you don't have anybody doing that, I think it would be virtually harmful to your community to not have any emergency services. So I think in a situation, I'll use you as an example, Dick, in the situation where you have multiple subrecipients in Sheridan County, I believe you have 1, 2, 3, you have 3 subrecipients in Sheridan County. One does a lot of intensive case management, VOA. One does emergency services, Compass Center for Families through the Parent Liaison Program, and one does a community initiative. That's well thought out planning. That is hitting a lot of the needs necessary in that community. For agencies, let's look at Christina. Her agency is a public agency, but they do provide direct services. They're looking at a case management model, and I don't know if this has been fully fleshed out yet. I'm not fully aware of that. But are there other agencies in Fremont County that are able to pick up that emergency services model so they can concentrate on that complex generational poverty piece? Which would be prevalent, that's really common in Fremont County. It really depends on the community. But yeah, we're hearing a lot of people wanting to make that shift into case management. And I consult with a lot of them and ask them to consider both in some way, if it's reasonable. And we work with a lot of boards to say, here's some things that I want you to think about going into that decision making. 'Cause Okay, so these are things again that we talk about when we're going into our planning, right? So as board members, these are things we have to think about. We're looking at our community needs assessment. We're going to look at what kind of money do we have? What's our needs? How are we going to address it? Are we going to address it through emergency services, a case management model, a hybrid? Are we going to be able to do strategies and services in our community? Are we going to do direct services? How are we going to do this? But I don't want you to forget about your agency or your subrecipients, because what happens when it's the agency or the subrecipients that are the ones that have the needs, right? So again, CSBG feels very strongly at the federal level that the board is responsible for ensuring that the agency and the staff have all the tools they need to be successful. So that means supporting professional development, appropriate staffing, administrative and board support, salary, fringe benefits, training opportunities, giving the proper planning, giving expectations. And honestly, I cannot tell you how many agencies I see that the vast majority of the staff would qualify for the services that are being offered by that agency. It's almost all of them. How do we afford that? It's so expensive to pay the quote unquote living wage. In Wyoming, considering right now living wages are at an all-time high of about $28 an hour. It's insane, but it's not easy to do that. Every day, every agency in Wyoming and across the country are being tasked with being required to do more with less. But ultimately, it is the board's responsibility to ensure that the financial sustainability of the agency is job number one. We do that through additional grant applications, fundraising, program fees, advocacy at the federal, state, and local levels. The good thing is that since all of you are members of CEAS now, I am here to help you through that process as well. So we talk a lot about advocating at the state level for matching budget line for CSBG. We talk about funding allocations for family resource centers to help our agencies get additional funding to do the work that we're doing. We talk about partnering with 211 so they can do a lot of that heavy lift around resource referral, so our agencies can concentrate on that 20% of clients that are the most need, that can't help themselves, right? We talk about what do we need to do to help build development in our agencies. But I urge you as board members to not forget about the costs of running an agency at either your subrecipient level or at the agency level itself. Investing in people are expensive, but that's what gives you the highest return on your investment and the highest return on the resources that you're going to be investing with your CSBG dollars. And those are all allowable expenses as using federal CSBG and all other federal funds as well. All right, any questions so far? Does anybody need a break before we go on? We only have just a little bit left to go and we've got 45 minutes left. Do you guys want to push through or does anybody need to take a bio break real quick?
I'm good to push through, Deb Craft.
Okie dokie. Push through. Any questions so far? Am I making sense or is this all gibberish?
Oh no,
Okay, here we go, guys. We're going to do it. We're going to push through. Now what do we do? Right? So now what? Now that we've identified the outline and the basic premise of how services are going to be provided at your agency, the management and the staff is going to now take over. The board has decided we're going to be the ones providing the directive services, or we're going to have partners in the grant called subrecipients. In Wyoming, we have some agencies with subs, some without. The board is going to take a look at all of the needs, all of the resources, all of the community information, and you guys are going to determine the best way to move forward and how we're going to provide services. Are we going to do emergency services? Are we going to have case management? Remember, there are pros and cons to both of these. Are we going to have subrecipients? Are we going to do the work ourselves? Then the board and the staff, including management, are going to work together to determine how to allocate resources to the service and the strategies that we determined we need to do. For example, let's go back to our need for housing. If we're doing emergency services around rental assistance, and we determined that last year, when looking at our data, without using any of our emergency rental assistance program funding, we were able to help 50 households avoid eviction by providing 1 month of rent at an average of $750 a month. We know by doing simple math that we invested $37,500 in avoiding families losing their homes, right? We kept them in their homes for 30 days. This year, though, rent has skyrocketed to $1,500 a month. And that's the story we're hearing all over the state. Now, we still have $37,500 to put toward rent, but now we can only provide rental assistance to 25 households because that's all we can do. But we also know that even more people than last year are experiencing issues around housing. So how are we going to provide these services? We're in a conundrum now, right? The board is going to have to make some really tough choices in this decision. Maybe the board decides that we can't pay rent anymore because it's just too expensive. But maybe we can help pay for childcare. Maybe we can invest money in more gas cards or fixing people's broken down cars or paying for licensing or insurance costs for cars, or maybe we can pay for work clothing or job training, or maybe we can invest more money in food, or maybe we can help people with utilities, or maybe we can help pay for other things that are going to allow people to earn more, save more, spend less. I don't know. This is where the tough conversations come in. And this is where we spend a lot of time talking. And this is where it gets hard. And this is where it gets sad. And I'm, Deb, I'm not going to throw you under the bus. I'm not going to, I'm not going to ask you to talk about it. But recently, Deb and I had to have this conversation in Bighorn. We knew that rent had gone up so much. We looked at how many people we were able to help last year with the amount of money that we spent. And so we had to make some tough decisions, right, Deb? We had to make the call. It's like, okay, well, we can only help now with gas, electric, and water. That's all we can do. We're not going to be able to make full rent payments anymore. We're only going to be able to pay up to certain amounts of money. We're not going to be able to help as many people as we thought we were going to be able to help. And that, I'm not going to lie to you, that sucks. It's disheartening to think that it feels like we're not making a difference anywhere. And I have to urge you to push through that. And it is difficult. And it feels crappy. I'm not going to lie to you. But you are going to be able to work through it. And you are going to be able to find the light at the end of the tunnel, because you're going to be creative about how we can serve instead of focusing on how we can't serve. And once the board and the management work together to create that general overall direction of that programming, then the management and their staff and that team is going to take over. And they're going to begin to work through the details of how this is going to work. They're going to work on that community action plan. They're going to start determining specific services, estimated numbers of people to be served, numbers estimated to achieve our outcomes, and how many of those are going to be successful. Some agencies use a logic model to show how they move through that, and I'm going to show you that logic model. This takes them through this process from beginning to end. This is what that logic model looks like. This is what we do when we do an all-day training for staff members on ROMA and how we can help use this logic model to work through from the beginning to the end. We teach this process at the agency level for those who will be preparing the agency for the implementation phase. So once we have all of that, the management is going to bring this plan back to you. And they're going to say, this is what we came up with the overall arching guardrails that you guys gave us to work within. We think, knowing what we know with the experience that we have working day to day, we think this is what we can do. We have these services, we matched them up with these outcomes, and this is how we're going to provide this service. So we then go ahead and submit it. Once you guys approve it, and we have to have the board action, we submit it to the state for their approval, and implementation begins on October 1st. So I wanted to show you what a sample logic is going to look like at the agency level, so you can kind of see the thought process that an agency or your subrecipient is going to go through, so you can see how they're going to carry out these services. And I'm going to apologize because some of this type is a little slow, but again, I am going to provide you with the slide deck so you can kind of blow it up on your own time and take a look at it. So when we're starting with our logic model, we always start with our identified problem, need, or situation. And this we get from our community needs assessment. And this is where we went through our assessment process. You guys told us, look, looks like housing is going to be our biggest one. And in housing, it looks like families are at risk of being evicted. This is what we know to be true. So our outcome because we're outcome and results oriented, we always decide next, what do we want our outcome to be? And this is always our obvious opposite. Well, if families are at risk of being evicted, then we want families to not be at risk of being evicted. We want families to remain in their own homes. So how are we going to do that? We do that by identifying a service or an activity that we're going to do that we think is going to make sure that they remain in their own home. In this case, this agency is going to provide 1 month of emergency rent payment that will be issued to 150 families within our program year. We know that this fits within our budget. We know that we'll be able to do this. And we think that out of 150 or 100% of the families that we give emergency rent to are going to remain in their homes for at least 30 days. Now, how are we going to know that? Well, we have to have a couple of measurement tools to make sure that we can show that that actually happened. And we do that in a couple of different ways. And these last 3 columns in a logic model is the accountability piece. First of all, we're going to take their application and we're going to record the rent payment, right? It's either a copy of the check and we're going to have a copy of their lease, like, yep, their lease is there. They actually live there. B, here's a copy of the lease or the copy of the rent check I paid. And here's a copy of their application so I can show you that they are economically or income eligible for this service. I'm also going to follow up in 30 days just to make sure that they're still in that home. And I'm going to use some case notes to ensure that I can tell you that I followed up with this family. And who's going to be responsible for this? Well, the case manager is going to collect all this data at the time of intake and at the time that we collect the check or we send off the check. We're going to take this data, we're going to enter it into our software, and we're going to also keep a hard copy file just in case our software goes down. And our frequency of collecting and reporting this data, well, our data is going to be collected at the beginning. And at a 30-day follow-up, we're going to report to our manager monthly, we're going to report to our board quarterly, and then our annual report to our community annually. And then we do the work. And we spend our time over the course of our program year working. And at the end of that program year, we count up everything that we did. And it turns out that at the end of the program year, we ended up serving 155 families. But only 142 or 92% of those families remained in their home for 30 days. But we decided to check up with them on a rotating basis. 132 of those 155, or 85% of those families, remained in their home for 60 days. But by the 90-day mark, only 90 or 58% of those families remained in their home for 90 days. So as we go through at the end of our program year and we're looking at our assessment of this data that we're giving, maybe some questions are being raised by this. So now it's a year goes by. It's time to start making the plan for next year. We're getting ready to do our community action plan. And some questions we're going to ask ourselves. Wonder why we served 155 families. Did we do anything different in our marketing? Was there more people? Did anything change? It wasn't that significant statistically, so I'm not going to ask too many questions about that. But I thought we would have 100% of those people remain in their homes for 30 days. And it turns out only 92%. I wonder what happened. We're going to go back and we're going to look at case notes. What prevented them from being evicted? I'm going to give you a hint. Just because you paid rent does not mean that those families aren't going to be evicted. Money is not the only reason people get evicted in our world. There are a lot of different reasons. And just because we paid that rent doesn't mean they're going to stay there. So we might want to start looking at that. And then that leads me to, well, as time goes on, even fewer of those people remained in their homes. And in 3 months, a little over half of those people remained in their homes. Why is that? Is it something that we did? Is it something they did? Is it something that happened in their community? I want to start asking those questions. And that's what data analysis is. That's what data analysis asks us to do. There should be a natural curiosity about our data that leads us to planning next year. So knowing what we know there, I want to show you what happened next year. Now this one's might be really hard to read because it's much more extensive, but I really want to just draw your attention to the first arrow right here where we're saying families are unable to maintain housing. This is a logic model that was a result of analyzing that data from the previous year in the previous logic model. They looked at what was happening in the outcomes long-term and realized that there was a reason why households were unable to keep housing. So they looked at why, and then they decided they needed to revise their services and they deployed their resources differently. They saw that some families needed additional assistance and that assistance might look different for around 50 of those families, and different services were added in this agency. This is a great example of why looking at data on a regular basis and asking questions of the data helped this agency better understand barriers and better refine their services to help people stay in their homes. Now, I don't know what the outcome was the next year, but I can tell you they have data now because they really started looking at short-term intermediate term and long-term outcomes. What did they need to do to make sure that families were able to stay in their home longer? So this is what ROMA is. All ROMA is a framework and a foundation of asking questions. Did we do what we said we were going to do? And if yes, why were we successful? And if no, why weren't we successful? So the final steps going into planning for the staff is allow that team time to develop that final action plan and their logic models. They should make sure that your team is including the following: a list of those action steps, resources that are required, staff who are going to be responsible for what, a timeline, outcomes, and methods for tracking that progress. And then the final steps for the board is to approve that strategic plan and record that board action. I cannot tell you how many people could not provide me with the board minutes that said, we approved this strategic plan and the community action plan. Very important for the organizational standards that I have that board action. You want to make sure that the board has identified the action steps that will include the board if required, right? So if they're doing an agency only or agency capacity only strategic board or planning session, then what steps are the board going to have? Make sure that you've identified action steps that the board will take. Make recommendations necessary regarding how the plan will be used to inform the implementation phase, and establish a timetable for review of that plan throughout the next year. And what are we going to do next week? Well, we're going to talk about implementation, the reporting of our data, and the evaluation. We'll go into much deeper about implementing, what it's going to look like as we provide these services, what it looks like when we report on our data, and what happens when we evaluate our data so we can start this planning process all over again. Okay, guys, that's it. That's ROMA in a nutshell. We've talked about ROMA. We're halfway through the cycle of ROMA. This hasn't been too complicated so far, I hope. I hope you join me next week when we do talk about those things that we, the implementation, the reporting, all of that fun stuff. Because while the board doesn't get involved in the day-to-day actions of what your agency is doing, it is so critical and so important for you to have a working knowledge of what they're doing. So as you're evaluating their reports, as you're asking for accountability, as you're asking for outcomes and how they're achieving those outcomes, it's so important to ask the right questions and keep them accountable, because at the end of the day, it's the board who is responsible. Any questions, pushback, comments, anything before I let you go for the rest of the day?
Susan, it's Deb Kraft. I want to say this has been a really big help to me, and I look forward to our final one next Wednesday. So thank you.
Glad, Deb. Thank you. And again, I will send these all out to you at the end to make sure that at the end of the session to make sure you have everything. Your board chairs, or not your board chairs, your EDs, whoever's doing the organizational standards will get records of all your attendance, so that can be going in for next year's organizational standards. And I hope that you embrace the foundation and the culture of ROMA. It's really, I drank the ROMA Kool-Aid. I fully on admit it, but I love the strategic thinking and the questions and the learning that comes from it. So have a great night. I will talk to you all next week. Do not hesitate to reach out with any questions if you have any. And Kristen, can you stay on for just 1 second before you sign off?
Yeah, so sorry my video was on that whole time. I was picking up my kiddos. So
I was like, yeah, dude, I watched you drive home. It was all good. It's all good. Thank you guys. Thank you.
Thank you, Susan. Bye.
Bye.
Thank you.
Thank you, Christina. See you next week. Bye, Dick.
Yep.
hello. Okay, I'm here.
I just I just wanted to thank you for coming as one of my board members and evaluating how this training went. And also just embracing the fact that you had a board member here. I just thank you. We had 8 people registered and only, well, 3 board members.
Yeah. Well, thank you so much for putting it on. It was excellent. And I just wanted to, is there anything I need to do for the strategic planning session next
No, I'm gonna reach
week
out.
or?
Next week already. Yeah, I was gonna reach out to you. Do you have time? Can I reach out to you tomorrow and we can set a time where we can chat really quick? I just want to
Yeah,
go
of
over
course.
details of what to do, what the room, I mean, do you have a room booked? Where we're gonna be? Because I need to
Yeah.
have all space. And so we'll just connect on that one. A lot of what we're gonna talk about is kind of what we did today. Was really talk about, we're going into this, what do you want your strategic plan to be about? You need to be thinking about what's important to Campbell County, what's important to you. So what's the question that we're going to keep going back to and answering through that whole strategic plan is really
Yeah,
what we're going to.
that's why I wanted to take this, is because I wanted to get that mindset, get in the mindset of, I thought it would be a good lead up. So
Yeah, and we're going to totally old school this. We're using magic walls. We're going to be using paste, put things up on the magic wall. Do you know who's all going to, I mean, do you have a roll call or a roster of who all will be there?
I know that I don't, but I should have one probably tomorrow at noon because I have a care board meeting then. So I will find out a better group.
What I hope that we can talk about on Friday, if we can meet on Friday or Monday of next week, is if you can get as many of your subrecipients there as possible, as many as your board as possible. If you have critical stakeholders in the community that you want there because you want them to have a say in or a piece of understanding about what the care board does, I think it's policymakers. I think it's great if you can get them there. It's a pretty heavy lift because we're talking about a day and a half of stuff. So that's I get that. But the more people there, the more brain power you get and the more engaged people are. So whatever you think is best, we can talk on Friday or Monday about the details. We're prepared and ready to go. I don't really, other than you facilitating a place for us to be and getting the people in the room, we'll take care of everything else.
Yeah, and I just thought that we'd order lunch from somewhere that I could take the order in the morning. It might be Jimmy John's or something like that, because I don't want to order a catering and then have 2 people show up when I thought 12 people were going to show up or whatever. So
I totally understand that. If 2 people show up, we might have a really quiet strategic plan, but it'll be our plan. So one of the things that we talked a little bit about, and I think we'll save this for your community action plan, unless you want to include them in your strategic plan, and that is your customer surveys. So
yeah, I don't mind including them in my strategic plan because it's just something that really needs addressed. So if we have time, I'd like to address them because, in my opinion, they need to be addressed just because I don't think the questions are useful.
And that might be part of our strategic goal. It might be, let's improve our customer service process.
Yeah, because the survey, we improved the process of getting the survey done. Like we got Survey Monkey, we got a QR code, we got all of that. But the survey questions are just, they're kind of like if you went to Walmart or something. Yeah. And I don't know that they're totally appropriate for the type of services that they're getting.
Well, and then we need to identify, ROMA tells us we have 3 customers. We have the customers we serve, the customers on our staff, and our stakeholders in our community are customers.
Ooh, yeah.
those are 3 levels of customers that we might want to take a look at someday. And
Yeah, and
looking at that is like, can we just start at the very basic? Are we doing what we said we're going to do, and do our customers feel that that they're treated fairly, that they are getting what they need? And then
Yeah.
we start expanding it. Year 2, we expand to this. Year 3, we expand to that. We'll let the group kind of decide how they want to get there. As long as we're incorporating it into our strategic plan, we'll meet that org standard.
well, and if we do survey data that it captures the voice of either both the staff, like the CSBG staff and agencies, and then also the voices of the community and stakeholders, then that could be a good information for our next community needs assessment.
Absolutely excellent. Now, Wyoming is one of the few states that has consultants do their community needs assessment. When I did a strategic plan in Montana, the agencies do their own, which I think
Well,
sounds
I was kind of wondering why we pay the consultant so much money to do
I
the
mean, what
CNN.
census data,
Yeah. So
you know,
I was kind
but-
of wondering what the reason was, because I mean, just our county was 15,000. So in total, like I don't know how the other
what you
counties
could do
afforded
with-
it.
what you could do with $15,000 in discretionary funds for professional
Yeah.
development.
Yes. Yes,
I mean-
especially for professional development, because a lot of those nonprofit agencies, that's one of the biggest benefits of CSBG, is that they cannot afford any professional development, or their caseworkers have to pay for it themselves or something, and
I
yeah.
look at that, I'm like, this is a broken system. And if we're going to come up with, and what the state wants to do is come up with that uniform needs assessment that meets all the org standards,
Yeah.
pretty simple to do a fill in the blank.
Yeah. I
Not
would,
hard.
I think that would be an appropriate thing to do, and I think it's totally feasible too. So
There is nothing that says you have to pay a consultant to do it.
yeah. So I just thought
$2,000
that
on
was
marketing
little.
just to send out the survey. Dear God,
Mhm.
it's ridiculous.
Well, and then also the focus groups that were organized, I mean, they hardly had any participation. So I'm
No.
like, well, I could have done that myself.
$7,500 in Johnson County to have 3 focus groups that not one person showed up to.
Well, there you go. Yeah. See, so
Yeah, I'm like,
I
I don't think so. I don't think
yeah,
we're-
because
I have,
when you have it, when you have somebody that's a nobody essentially to your agency, trying to plan the focus groups, you don't get it. But if you, I don't know, have staff who has the relationship with the people that you want to talk to, especially if they're clients, if
Lived
they hold the
experience.
focus group, then then they are more apt to, if we're extending personal invitations to them, then they're more likely to participate. But if you try to cold call that type of stuff, no one comes. So
There's a cheaper, better way that we can do it. So anyway, thank you for attending. I look forward to talking to you soon. I can't believe it snuck up on us this quickly that it's next week, but I'll see you next week in person.
thank you. It was excellent. Sorry I made you watch me shake all around the screen. And
No, that's okay. I don't actually, I couldn't see anybody. I have my notes up, and so I'm like, I can't even see the gallery.
yeah.
So y'all don't have to look at me going, where am I at on my screen?
Yeah. Well, have a good night, Susan.
All right, thanks. Bye.
Bye.